Pain control is something that is very important to this practice. Our goal is for the entire process to be easier than what the patient had in mind, so that they may say, wow, that was a lot easier than I had thought. I wish I had done it a long time ago. Too often we hear of instances where patients woke up during their procedure and had nightmares during their procedure, or the postoperative pain was terrible. These terms we don't like to hear in this office. We have instituted an enhanced recovery protocol quite some time ago that uses a combination of medications that begin before surgery and are taken through the recovery time to really help with the postoperative pain. In addition to that, we use medications to cover all of the pathways for postoperative nausea and vomiting. We really are focused on helping the recovery from surgery be as good as it can. Another important part of selecting the practice that's right for you should include what happens if I have a problem. You should ask, what happens if I have a problem? And in identifying what the problems are, we have risks that are identified with every operation. For instance, blood clots in the legs. That's a risk that comes with any anesthetic that the patient undergoes. The ones that the physician and the physician's office can have to deal with on a more regular basis might be things such as postoperative infection, such as postoperative bleeding or hematoma at the surgical site. One of the most common postoperative complications that we can use to get to the bottom of what a practice is made of is postoperative hematoma. What happens if I have bleeding after surgery? Will I be taken care of, and will there be cost for that? We have a very open financial discussion with our patients before surgery is even contemplated regarding what the costs of surgery would be. And we have a system here such that the cost to the patient includes anesthesia, includes facility, includes the implant, and there are no hidden costs. Having no hidden costs it should be very important to every consumer. When our patients have problems after surgery, it is incumbent upon us as healthcare providers to see them through those complications. Yes, there may be costs associated, for instance, if you have to buy some gauze material or whatnot to help an area that is a little slow to heal. But we do everything we can to help minimize the costs. We also never abandon a patient, which means if you have a problem and you can get here, we're going to see you and we're going to help you through your problem.